Rhode Island's top health officials are set to announce who will be getting the COVID-19 vaccine. Good evening, I'm Mike Montecalvo.
And I'm Shannon Heggie. This announcement is expected to be made during the state's weekly COVID-19 briefing on Thursday. 12
News reporter Brandon Truitt is live outside the Department of Health in Providence with the latest on the vaccination efforts and what could happen to any unused doses. Brandon?
Well, Mike and Shannon, that update from the Department of Health on Thursday is going to be a big one, as there has been much debate around who should be included in Phase 2. All of this coming as today I've learned what is happening with those extra doses from Phase 1.
Phase 1 of the vaccination efforts in full swing in Rhode Island, but who's eligible next, set to be revealed in a matter of days.
We are releasing our plans on Thursday, and of course we will update them as needed.
The debate over who will be included in Phase 2 front and center over the last week, including whether teachers will make the cut.
Have you landed on where teachers will go yet?
So we've received input from all sorts of sources, including our Rhode Island Vaccine Subcommittee, and we'll release some further details on Thursday for sure.
While we wait for that announcement, Phase 1 is moving ahead. The state has been partnering with CVS and Walgreens to administer vaccine in nursing and group homes.
This week will be the halfway mark.
The pharmacies visit each location 3 times, each visit spaced 3 weeks apart. The state must provide enough vaccine for anyone in those centers, but not everyone wants it.
If they have extra, what happens with that?
What CDC opened to us recently was the opportunity to now defer vaccine.
The state will move any extra doses from the CVS Walgreens allotment into the state's own pool, allowing them to use it how they see fit. But the Department of Health says they won't have a total until the pharmacies finish their rounds.
It would be unfair for us to really try to gauge how much we would be taking back altogether.
So the state says what could really help them right now is just getting in more vaccination. As it stands, the state's receiving 14,000 first doses a week. That number, we are told, could go up as soon as next week. Live in Providence, Brandon Truitt, 12 News.
Here in Rhode Island, we're finally expected to get some clarity later this week about who will be eligible for shots next. We've learned the Department of Health will announce plans for Phase 2 at their briefing on Thursday. Now, as of today, the Health Department says more than 17,000 have been fully vaccinated, while over 60,000 have received the first dose. As 12 News reporter Brandon Truitt found out today, the state may be getting some unused vaccines back.
As we've reported, the state is in a contract with CVS and Walgreens. That means they have to set aside a certain number of doses each week for them. Today we learned that once those pharmacies finish those rounds in nursing homes and congregate care facilities, the doses not used will be freed up for the state to take.
Tonight, Rhode Island well into Phase 1 of vaccination. Nursing homes highly prioritized early on. The state partnering with CVS and Walgreens to handle distribution there.
This week will be the halfway mark.
The contract with the pharmacies requires 3 visits to each nursing home, each visit spaced 3 weeks apart.
So at the second clinic, which started last week for nursing homes, people who didn't get first doses at the first clinic were eligible, as well as folks who were ready to get their second doses.
That same process is happening at group homes now, too. At the end of each round, there's a chance for unused doses.
If they have extra, what happens with that?
What CDC opened to us recently was the opportunity to now defer vaccine.
Extra doses go back to the state, used how they see fit.
Based on the number of people who we anticipate will get vaccinated over the course of the next 2 weeks, we can look at the allocation that's going to CVS and Walgreens and pull either some of that vaccine or all of it out of their allocation and into the pot of vaccine we are able to draw from directly.
The state could not give an exact number or where they would go, but expects a clearer answer in the coming weeks. As we've reported, roughly 40% of the vaccine the state has on hand is on standby, part of it allotted to the pharmacies. The state says what would help create a faster flow is an increase in the weekly vaccine delivered.
We are ready to go. We want everyone in Rhode Island to get the vaccine and at least have access to the vaccine. So we're getting there. Again, patience is sort of the key to this process.
And all of this comes as there are reports questioning whether or not states who chose this partnership with CVS and Walgreens are moving slower with distributions than those who didn't. Today, the Department of Health tells me they're not looking into that fact, but they are tracking the distribution efforts. Everything is moving at the pace they say that they expected. In Providence, Brandon Truitt, 12 News.